Okay, these two vertebrae are C1 and C2. So this one is also known as the atlas, and then we have inferior to it the axis. So C1, from a superior view, you can see the large superior articular facets, which are what articulates with the occipital condyles on the occipital bone. So the inferior aspect of the occipital bone sits in here nicely, and it'll allow the skull to rock back and forth to flex and extend. Other landmarks on the atlas, which identify it, is the anterior tubercle and the posterior tubercle. So the atlas, unlike other vertebrae, doesn't have a body, and it doesn't have a spinous process. Instead, it has a posterior tubercle and an anterior tubercle. Laterally, we have the transverse process, the large transverse process, and going through it there is a hole. This hole is called the transverse foramen. You'll see this hole on all of the cervical vertebrae. Other landmarks you can see on it are the inferior articular process, and where the flat part is, or where they connect, is the facet. Okay, if we look at C2, we have one that's on its own here. You can see the dens. This is what identifies C2. Okay, it basically replaces the body of C1, and it sits in here against the anterior tubercle, and it's held in place by a ligament. C1 and C2 allow for rotation, or that no movement. Okay, other structures on C2 that we can see is it still has a transverse foramen, and it now has a spinous process. So the spinous process is often bifid or split into two. It's not just one point, but it has kind of two little points here. In terms of the shape of the vertebral foramen, where the spinal cord passes through, it's considered to be a triangle in shape, although kind of hard to see. All right, the next vertebrae, as we go down, that most of them are similar, is C3 to C7. They all typically look like this. As you progress from C3 to C7, they get a little bit larger. So here we have the body of C3, and this hole here is just a remnant of where a rod would pass through to hold them all together. So we don't actually have a hole in the body. The body's considered rectangular in shape. We have the vertebral foramen, which is a triangle. It has a bifid spinous process, so this one here, it's been broken off. Laterally, we still have the transverse foramen. Here you can see the superior articular facets, and below you can see the inferior articular facets. Okay, as we progress downwards, inferior to the cervical vertebrae, we have our thoracic vertebrae. And these vertebrae are easy to identify based on the fact that the spinous process points downward, and it's quite long. Okay, so the transverse vertebrae, other characteristics of it that give it away is its vertebral foramen is now circular in shape. The body is considered heart-shaped. You can see the large transverse processes that come off of it. And we have our superior articular facets and our inferior articular facets. In terms of direction or orientation, these articular facets are directed anteriorly, these ones, and posteriorly here. The way these articular processes are situated allow for certain types of movements or restrict certain movements. You can also see nicely on these ones the vertebral arch, which is formed by the pedicle, which is between the body and the transverse process, and the lamina, which is between the transverse process and the spinous process. Okay, so you can nicely see the arch on this side. When we stack vertebrae together, you can then see the intervertebral foramina laterally. This is where spinal nerves will pass through. Okay, as we progress downwards, the vertebrae get much larger. So this is a lumbar vertebrae, and in comparison in size to a cervical vertebrae, it's much larger. So the reason why it's much bigger is because it has a weight-bearing function, or an increased weight-bearing function. It has to hold up more weight. It has a large body, which is the weight-bearing portion. It's considered to be kidney-shaped. Again, this is just a hole where a rod would pass through. The vertebral foramen is back to a triangle. It has these transverse processes. The spinous process is quite short and stout, sometimes described as hatchet-shaped. And again, we can see the large articular processes, or the flat part is the facet. So here's the superior articular facet, and below is the inferior articular facet here. So this is a lumbar vertebrae. One thing I forgot to point out on the thoracic vertebrae, which I'll go back to, is we have 12 thoracic vertebrae and we have 12 ribs. All of our ribs attach to the thoracic vertebrae. So a portion of the rib will attach to the body. These kind of indentations here are where the head of the rib attach. The rib then curves around, and a portion of the rib, the tubercle, will attach to the transverse process. These articulation points are called costal facets. So costal referring to the rib. Okay, so the rib is here, and then it wraps around like this. So I think that's it.